Bismillahirrahmanirrahim. Assalamu alaikum. In this video, we will explain the retroparotid type of retromandibular approach. As we mentioned in our previous video that there are two varieties of retromandibular approaches used to access the posterior mandible, the transparotid and retroparotid approach. They differ in the placement of incision and anatomic dissection to the mandible, and the retroparotid approach that has the advantage of not dissecting through the parotid gland. The dissection is done behind the parotid gland. An oblique incision is made through the skin and subcutaneous tissue, extending from the mastoid process to the point just below the angle of the mandible. The subcutaneous tissue is undermined, exposing the superficial musculo-eponeurotic system. An oblique incision is made through the superficial musculo-eponeurotic system. The posterior aspect of the gland is identified and dissection continue behind the gland. The gland is lifted off the masseter muscle and retracted interiorly. Here you can see the parotid gland and masseter muscle. They are retracted interiorly. Once the posterior border of the mandible has been reached, an incision is made through the pterygomasseteric sling. The periosteal elevator is used to strip the masseter muscle from the ramus. Further dissection continues superiorly along the posterior border, exposes the condylar process. This is the illustration of the amount of exposure obtained using this approach. The wound is approximated in layers for anatomic realignment and avoidance of the dead space. 2 or 3 sutures are placed through the pterygomasseteric sling as shown. The skin and subcutaneous tissues are then closed based on surgical preference. Thank you. Have a nice time.